total lack of professionalism. Well, good afternoon, everybody. Welcome to another Exeter Science Park webinar. Today I'm delighted to be joined by Jon Cooper. Jon has been doing some work with us at Exeter Science Park. He's a partner and leads the nationally renowned health and safety practice at Womble Bond Dickinson. And he and his team have been involved in many of the major health and safety investigations and prosecutions over recent years, including the Buncefield explosion that you might remember, the investigation and prosecution arising from the explosion at the Pembroke Dock Oil Refinery, resulting in multiple deaths, and Grenfell Tower. I'm sure, like most lawyers, he would far rather be involved to prevent things happening than to have to mop up the mess afterwards. But I'm going to stop at this point. I'm going to hand over to Jon. Jon, thank you so much for being with us this morning.
Thank you, Sally. Good morning, everyone. Just picking up on Sally's point, it's all very well dealing with major investigations and defending prosecutions, but that's not really what clients should be looking for from the lawyers. They really want someone who can guide them through the regulatory regime so that they're not in those horrible positions of having to defend proceedings. So we try to be, as it were, the fence at the top of the cliff rather than the ambulance at the bottom of it. We got 30 minutes or so today, so rather than listen to a lawyer speak at you for 30 minutes, which, as you know, we're more than capable of doing, I'm going to go through a few topics in the next 10 minutes or so, and then hopefully it will turn into a question and answer session or some form of debate. Happy to pick up any questions which might arise. What I'm dealing with are obligations under the current statutory regime, which is primarily the Health and Safety Work Act of 1974 and the plethora of regulations made under that act. The impact of COVID-19 on that, and then really looking forward as to what might change in the light of COVID and the impact that it's had on our everyday and normal working lives. So, starting point is that the Health and Safety at Work Act and all regulations in the UK are not a guarantee of safety. There's no obligation on employers to guarantee the safety of workers or of others who are affected by their business or by their undertaking, which may be customers, visitors, contractors, and the like. It's all quantified or qualified rather by what is reasonably practicable. And what that involves is a balancing act between the nature of the risk and the likelihood of that risk manifesting itself in harm and what reasonable measures can be taken in order to address that risk. There's been a lot of misinformation in recent weeks in the light of COVID-19, and phrases such as a COVID secure workplace are really not helpful, because the government's been talking in terms of COVID secure workplaces, but the law and the HSE guidance recognises that there is no guarantee of safety. So employers and organisations have to do all that's reasonable to identify and manage risks. And that really comes down to risk assessment. Now, risk assessment is the cornerstone of health and safety management. It is really a process whereby you go through the risks which you can reasonably identify as arising from your business, and as a result of that exercise, putting in appropriate control measures to eliminate that risk or to reduce it to as low as is reasonably practicable. There is an interesting argument to be had, actually, as to whether the Health and Safety at Work Act and the regulations made under it apply to the risk of COVID-19. And the reason I say that is because the risk which you're taking steps to guard against has to arise from your undertaking, your business activity. The argument, therefore, is that, well, COVID-19 is a pandemic, it's a public health risk, it does not arise from your undertaking, and therefore the health and safety legislation doesn't apply to it. HSE plainly, through the guidance they've issued, take the view that Health and Safety Work Act does apply to the risk. And I think the argument would be that, well, if you don't have reasonable steps, reasonable measures in place to prevent the spread of infection in the workplace, then that is attributable to the employer. I think as a matter of law, that may well be wrong. But morally, you can see why nobody wants to break ranks and say, actually, I'm not going to take any additional measures to manage the risk specifically associated with COVID. Guidance is another topic which has been very much to the fore in recent weeks. And guidance has been issued by central government and through agencies such as HSE and PHE. There is no sanction if you do not follow the guidance. It is simply that. Under the Coronavirus Act, various regulations were made, both in England and Wales, England, Wales, Northern Ireland and Scotland. And if you breach the regulations, then that can lead to enforcement action, including prosecution. But breach of the guidance itself does not give rise to any sanction. Where it plays in is that if you are not following the guidance, then the argument would be, leaving aside my earlier comments as to whether the Health and Safety Work Act applies at all, that if you are following guidance, you're doing all that is reasonably practicable, therefore discharging your obligations under the Act. Whereas if you're not following guidance, then you're not discharging that duty and therefore can be subject to prosecution under existing health and safety legislation. So that's where guidance and legislation sort of comes together. What I want to do now really is to look at what's been the impact on COVID-19 in the working world from a health and safety perspective, and really see how that might become a permanence going forward, or how it might change both our attitudes as organisations and employers, but also those of the enforcing authorities, such as the Health and Safety Executive, local authorities, and the like. There's been a fundamental shift, of course, in that people have been actively encouraged to work from home where possible. And although we're now entering into somewhat confusing relaxation of the lockdown regime, that remains the fundamental principle, that if you can work from home, you should do. What shouldn't be overlooked is that an employer's duty to his or her employees exists, whether or not that employee is in his or her normal workplace, or as millions of us are at the present time, is working from home. So there is a duty to carry out a suitable and sufficient risk assessment. And that duty is not changed or diluted by the fact that you're not in the normal workplace. What difference does that make? Well, the reality is that health and safety legislation, insofar as it relates, and it does relate to home working, simply has not been enforced. Good organisations have been giving very clear guidance in terms of how employees should look after their own health and well-being while at home. There's been lots of online tutorials, for example, about workstations. There has been, again, from good employers, a recognition that working from home can bring challenges in terms of isolation, not be able to talk problems through, lack of confidence, and that comes into the well-being agenda. And again, going back to basics, it's worth remembering that health and safety obligations, the obligation owed by an employer to an employee, extends to health, safety, and welfare. And that includes the mental health. So are we ever going to go back to what we were 84 days ago? The reality is probably not. I think home working will become more normal in many professions and many occupations. It'll become more acceptable and more accepted. But that, I think, will inevitably lead to a much more rigorous approach by the enforcement authorities in relation to home working. The TUC is already concerned about this, that effectively through working at home, health and safety obligations are being given a wide berth by the enforcement authorities, and I think that will change. And so I think organisations will be expected to be more rigorous in the risk assessments they carry out in relation to home workers. They will be expected to carry out a sort of sheep dip sampling of employees working from home to make sure that safety issues are covered. And I think the well-being agenda is very much going to remain to the fore. There is no doubt that not having that daily contact with co-workers does potentially have an impact. And I think sort of the evidence has been that anxiety has increased as a result of the pandemic. That, of course, may be anxiety relating to health. But again, there's research, particularly from organisations such as Loughborough University, which shows that if you remove workers from their normal workplace, the normal human exchanges that go on, it can have repercussions on mental health. And in the run-up to, or not in the run-up to COVID, but in the months prior to COVID, we'd seen a very marked change in attitude of the health and safety executive towards mental health. It was driven by the last chief executive, Martin Temple, who is very keen on ensuring that employers understood their obligations extended in terms of health to mental health and well-being as well. We've seen that being pushed forward. We've seen sort of high-profile mental health issues arising from work, for example, in the world of film, television. And HSE are very keen, I think, to establish some form of precedent by way of enforcement action in relation to well-being. If I was asked to have, as it were, a crystal ball overview, I think that there will be enforcement action. It's more likely, I believe, to be in the education or health sector. But I think mental health will be subject to enforcement action in terms of imposing duties on employers going forward. And I think that may well have been accelerated, that position might well be accelerated by the current pandemic. That's really sort of canter through just where we are in terms of the law and a few personal observations as to where I think changes might occur, particularly in relation to enforcement. I'm happy to pick up on any of those topics or in questions. Sally, if you'd like to open the question session, we'll move to that now. Are there any questions?
John, can you hear me?
I can hear you, yes.
I can hear you, yes. Yeah.
Great. So, sorry, let me just try to summarize. 84 days when the world's changed, mental versus physical health, regulations versus guidelines, and the potential that we're all in a different position without a requirement to guarantee safety. So yeah. I think my first question, John, was really, what's the position when the government changes its social distancing guidance, despite the fact perhaps that scientists come out and say, well, we think 2 meters is still the number that we prefer to see?
Right. Okay. That's a really good question.
Right. Okay.
The starting point is, of course, that employers. Sorry, do you want to mute your mic, Sally? I'm echoing.
Sorry, do you want to mute your mic, Sally?
Sorry, yeah.
So, yeah, the starting point is what is reasonably practicable. And if the government guidance is to the effect that social distancing can be reduced to 1 meter, even if that guidance is introduced contrary to scientific evidence and is really introduced for economic reasons, and I think that's the reality it will be. Will an employer be subject to enforcement action even if that employer doesn't believe that there is good science behind the easing of restrictions? Will that employer be subject to enforcement action? And I think the answer to that is no. The ultimate enforcement action is prosecution, and prosecution, before anyone can be prosecuted, the prosecuting authority has to be sure, has to be satisfied that there is a reasonable prospect of conviction. And if so, that prosecution is then in the public interest. And I cannot see any circumstances where an employer is following guidance, even if that guidance is not based on good science, that from an enforcement perspective, that employer would be subject to enforcement action.
John, thank you for that. I don't know whether that was my machine slowing down or yours. It's a question from John White. What do you see as the likely fines level for mental health?
I can deal with that very quickly. Thanks for the question, John. The sentencing in health...
John, I think you're muted.
Oh, sorry.
Oh, sorry.
Can you hear me now? Yeah. Sentencing in health and safety cases is now governed by what's called the definitive guideline. And what happens is that the court has to make a determination of the level of culpability, which ranges from very high to low. The level of harm risked, which is level A for death or catastrophic injury, level B slightly lesser but with long-term effects, and level C for all other degree of injury. The court then has to determine what the likelihood of that level of harm occurring is, and having done so, it applies a matrix in the form of a table, which is dependent, of the figures there are dependent on whether you are a micro-organisation, a small organisation, a medium organisation, or a large organisation. So those are the principles. So it depends entirely on turnover. Where I would see the battleground as being is that it would be difficult to show causation of mental health. You don't have to show causation for criminal liability. You just got to show that there's a risk of that illness developing. So I think causation would be an issue. And I think culpability would be one of the battlegrounds, because unless there was a failure to heed warnings or issues have been raised previously, I think it would be it's difficult to see a court assessing culpability at higher than medium. But those are the factors. But so the guidelines would be applied in the same way as they are in non-mental health cases.
Great, thank you. Richard has asked, can you clarify the Riddle position regarding COVID reporting? He says there is some confusion on when and when not to report if a person contracts COVID, specifically in a non-health care sector environment.
Thank you, Richard. That's a really good question. I think you're being kind when you say that there is some confusion. I think the guidance has been written to enhance HSE's narrative and not with regard to what the law requires. There has been no change to the RIDDOR legislation. What HSE has done is issued guidance and is issued guidance as to when an incident must be reported as a dangerous occurrence under RIDDOR. So that would be loss of containment of COVID-19 material. That plainly can only apply in a laboratory or healthcare sector. The second one and the third are really linked. The second one is, when should it be reported as a notifiable disease? Now, HSE's view is that you must report it as a notifiable disease if there is evidence that reasonably suggests that it was contracted in the workplace. Now, I'm struggling to see any circumstances in which you could say that that threshold of reasonable assumption that it's been contracted in the workforce could arise. And the reason I say that is it's a public health pandemic. Unless you have individuals who are not potentially exposed anywhere else, so they need to be living alone, they need to be, as it were, on the premises, which is why the health sector, healthcare sector may be an issue. You have to show that there's no risk of them having contracted it on their way to and from work, particularly if using public transport. So I think the circumstances in which you would need to report it as a notifiable disease, or if it led to death as a work-related death, are few and far between. And I think HSE would struggle to find the evidence to prosecute if an employer took the view that, well, I can't be satisfied that it's a reasonable conclusion that this is work-related.
Thank you, John. Richard, I hope that answers your question. John White, I hope that answers your question as well. One of the things, John, that we've seen is there seems to be quite a demographic difference in terms of people wanting to come back to work. Younger people, perhaps with a little less space at home, are keener to come to back to work than older people, perhaps with larger space and sort of a bit quieter. We've got this thing that's about work at home if you can, but there's clearly a balance between physical and mental health to be drawn. And I wondered how you would sort of put that when talking to staff.
Yeah, I think that's good. Sorry, Sally, could you mute again?
Could you mute again, sorry?
That's it. Yeah, I think that's going to be an increasingly difficult topic for employers and employees to approach. Your duty as an employer is to take reasonably practical steps to ensure health, safety and welfare of employees. And of course, if you have more than one employee, there may be conflicting approaches. You may have workers who want to come into work and others who do not. It's all about risk assessment. What I've seen, particularly in the retail sector where they've been operating and will continue to operate so far, is that there has been some debate that some employees feel that they are at greater risk through working at home than coming into the workplace. And the examples that I've been given by my retail clients are because of mental health. They just feel that their health is going down because they're at home. They need that contact, and also in relation to some of them, unfortunately, because of domestic abuse. They'd rather be out of the home. Now, the sort of rather callous legal view is, well, your duty of care doesn't extend to your employees at home. But I think if you are saying that only, for example, let's say essential workers can come in, those on the shop floor, whereas office workers can work from home, I think if you're going to depart from that consistent approach, you need to be able to have a really good risk-based reasoning behind it. And it's quite difficult to see because the risk is often associated not with risks from employment, but the risks from home factors. And you're getting the crossing over there, sort of legal and moral duties. So I think it's a very interesting and difficult point.
Thank you, John. So one other question here. Building landlord responsibilities for common areas. If a landlord refuses to implement COVID measures, are they breaching their duty of care?
I think you've been looking in my inbox, Richard. I've been advising on that this morning, actually. Let us say you are the landlord with responsibility for, as you say. The short answer to your question is yes, because, and I say that for two reasons. The landlord was responsibility for common areas has a duty under the Health and Safety at Work Act under Section 4, because that landlord has obligations which come from his interest in the land or interest in the property. But also the landlord's undertaking will be or will include the running of a property portfolio. That's a landlord's undertaking, and therefore they do have a duty to take all reasonably practical steps, which would, we would say, include implementing COVID measures and COVID guidance. There's another area which is going to come to the fore in the next few days, we're seeing it already, is that there is an obligation on employers who share a workplace to cooperate and coordinate their own health and safety risk management activities. So let us say you had a retail centre, a shopping centre where there was a facilities manager, facilities management company and various retailers within those premises. There should be cooperation and coordination and sharing of risk assessments to make sure that all are not just identifying the risks to their own employees, but the risks to others arising from their undertaking. So the case I was advising on this morning is where you have the landlord responsible for the common areas and maintaining the common areas and safety within the common areas of a shopping precinct, not making sure that they are enforcing distancing procedures when customers are queuing for individual shops. So quite a lengthy way of saying, Richard, yes, landlords do have a duty of care.
Thank you, John. Richard, I hope that answers your question. It's certainly something that we've been thinking about very hard and implementing a lot of change at Exeter Science Park, and John's advice has been very, very helpful in getting us to think not only about the risk management side or risk assessment that we'd already done, but also in terms of our responsibilities and the need for us to engage very productively with our clients here at the Science Park. I think we've got perhaps time for one quick question.
Of course.
So if you've got a burning question, now would be the time to answer or to ask it. John, it's as we sort of come out of this whole COVID thing, or let's say we're coming to, I think, what the government calls step 3 at the beginning of July, and perhaps a reduction in social distancing. And indeed, I think I remember you saying that the COVID Act times out in September. Do you think we're going to get to a point legally where this is sort of brushed under the carpet almost, or do you think this is going to stay up the agenda for quite a while?
I think the cynical lawyer in me says that it will remain current whilst there is a risk of some form of public inquiry or investigation to follow. I think there will be. I think one fundamental change which we have seen, which has been unexpected, is the assumption that what is essentially a public health issue becomes an occupational health issue. I mentioned earlier the argument that, well, Health and Safety Work Act doesn't apply because it's not a work-related risk. Whilst I think that is probably right as a strict matter of legal interpretation, certainly the wider public perception and understanding is that, well, employers have a duty not to spread, not to allow conditions to exist which may continue or increase the spread of infection. And I think that mindset is permanent. I think employers are going to be expected to be conscious of public health risks and are going to be expected to take obligations going forward. So I don't think it'll all be forgotten. I think inevitably it will lead to there will be a decrease in emphasis. But I think it is going to be something that's, if not at the forefront, it's always going to be just below the surface. And I think that is going to be a fundamental change.
Great, thank you, John. Well, we haven't got any more questions, so I hope you've enjoyed this this webinar. Jon, thank you very much indeed for your time.
Pleasure.
Ariane's just put out something saying we've got another one on organisational culture in a post-lockdown world on Wednesday. I hope you've enjoyed it. Thank you very much. I suggest we call this a day here and have a great afternoon.
Thank you.